Do you frequently feel like your skin is on fire or your stomach is rebelling after a major medical treatment? Imagine your body suddenly turning against itself, not because of a virus, but because of help that came from someone else. That's what can happen in graft-versus-host disease, or GvHD. It usually occurs after a person gets a stem cell or bone marrow transplant, often to treat cancers like leukemia. The new immune cells, the graft, see your body, the host, as a foreign invader and attack it. Think of it like friendly soldiers mistaking your house for an enemy base. Though the transplant is meant to save your life, sometimes these new cells go rogue. What causes GvHD? Let us pretend you are getting a software upgrade for your phone. You install it hoping for better performance, but instead, the new system starts deleting your personal files. That is similar to GvHD. When a patient receives donor bone marrow or stem cells, usually from a family member or matched stranger, those new immune cells come with their own instruction manual, their DNA. If they are not a perfect match, or even if they are close but not exact, the new immune cells may not recognize your body's cells as self. So they attack your skin, liver, gut, and other organs. It is more likely if the donor is not a close match, or if the patient is older. Even with perfect matches, it can still happen, like two cars looking the same but having different keys. How do you know if you have GvHD? Let's play a quick game. Point to where you feel off. If you pointed to your skin and said, "It's itchy, red, and feels like a sunburn," that's a classic sign. If you're suddenly breaking out in rashes after a transplant, it could be GvHD. How about your gut? If you're facing unstoppable nausea, diarrhea, or stomach cramps like you ate bad food, but you didn't, that's another clue. What about your eyes or mouth? Dry, burning eyes or mouth sores that won't heal. Also common. There are two types. Acute happens within first 100 days, and chronic shows up later, sometimes months or years. Chronic can feel like sudden dryness everywhere, like your body forgot how to make tears or saliva. Real talk, it's like your body's alarm system misfiring in every room. So you're feeling strange after your transplant. What next? Doctors don't guess, they check. They'll look at your skin, blood tests, and might take small tissue samples, a biopsy, to see if the new immune cells are attacking. Blood work can show if your liver is stressed, like a check engine light for your body. For diagnosis, timing matters. If symptoms start early, it's likely acute GvHD. Later, possibly chronic. Treatment usually starts with steroids, drugs that turn down the immune system's volume. It's like turning down the heat on a stove when it's boiling over. But if steroids aren't enough, doctors might add other drugs, like tacrolimus or sirolimus, to calm the immune response. The goal is to stop the attack, but not shut down immunity completely, or you'd get sick from infections. It's a balancing act, like taming a guard dog without making it useless. Can we stop GvHD before it starts? Yes, and here's how. Think of prevention like setting house rules before guests arrive. Before the transplant, doctors carefully match donors to patients, checking genetic barcodes called HLA types. The closer the match, the lower the risk. Often, patients take immune-suppressing medicines like methotrexate or cyclosporin right after transplant, a bit like giving the new immune cells a chill pill. Also, sometimes doctors will deplete certain cells from the donor graft, removing the troublemakers ahead of time. Another trick, using blood from a baby's umbilical cord, which is gentler on the host body. Prevention isn't perfect, but it's like wearing a seatbelt. It won't stop every accident, but it helps you survive the impact. Imagine scientists creating a GPS tracker for immune cells. That's kind of what's happening. Researchers are developing better tests to predict GvHD early, using blood markers like a weather forecast for your body. Some new drugs, like JAK inhibitors, for example ruxolitinib, are showing real promise. They help stop the immune attack and are now approved for steroid-resistant cases. Clinical trials are testing regulatory T cells, special peacekeeper cells that can calm the immune storm. Think of them as diplomats sent to stop the war. Also, gut microbiome studies show that healthy bacteria in your intestines may help prevent GvHD. Yes, your poop might one day help save lives. These advances mean fewer side effects and better quality of life for patients. Hope is growing, one cell at a time.